The Affordable Care Act open enrollment period is officially underway. Millions of Americans making decisions about their health coverage for next year. But with premiums expected to rise and, of course, some federal tax credits set to expire, finding affordable quality coverage could be more challenging than ever. The Robert Wood Johnson Foundation is urging families to take advantage of open enrollment before the January 15th deadline. Don't wait till the last second. Stay informed about changes that could affect their costs and coverage options. And Dr. Katherine Hempstead is the Senior Policy Officer with the Robert Wood Johnson Foundation. She's here with us to help understand what's challenging, what's changing, what's to watch, and how families can make the best decisions for their health coverage this year. Good to have you on, Dr. Hempstead. Thank you for coming on this morning.
Good morning. Thank you for having me.
You bet. It just kind of makes your head spin. And the crazy thing is, I didn't realize statistically that the vast majority of Americans are on Medicare or Medicaid, that it's a relatively small number, but still a large number. But overall, it's like less than 10%, right, who are on the Affordable Care Act. But nonetheless, that's a lot of people with open
Yeah,
enrollment who have to figure out what's going on. So what's
it's
going on
true.
this year?
Sure. I mean, and you're right. In New Jersey, it's about 500,000 people that rely on the Affordable Care Act, the individual market for their coverage. But it's a smallish segment of the population, but it's something that's increased in the last several years as the plans have gotten more affordable. And it's also important to remember that most of these folks don't really have another opportunity to
Mhm.
get coverage because they're too young for Medicare, they don't qualify for Medicaid, and they don't get an offer from an employer. So the marketplace is really important for them, and open enrollment is an important time for them to choose a plan. But what you said at the beginning is correct, that many people, in fact almost all people, are going to come back to the marketplace this year and find that the plans are a lot less affordable because a really
Mhm.
important set of federal tax credits is set to expire at the end of the year, which means that the 2026 premiums are going to be higher.
And I will say this, that I live part-time in Florida, part-time here. And in other states, I hear nightmarish stories about what's available, but in New Jersey, I've heard some really good stories for people who are working really hard, like lower middle in terms of being on the economic scale, and they finally got a decent healthcare plan over the last few years through this ACA. So I mean, there are some good stories, but unfortunately, because of the sunsetting of the government kicking in some money toward the insurance companies, this is going to change. So this could end up costing a lot of families a lot more money, right?
Yeah, unfortunately, it's a pretty major hit for a lot of people. There's a ballpark estimate that the average person is going to see their premiums go up by 100%, which is, of course, a big number. But there's such a big variation in what that really means. There are a lot of people who were paying, very low income people who were paying a $0 premium, who are going to now be asked to pay maybe $60, $85. So that's, in dollars, might not seem like that much, but sort of
Mm.
percentage wise, it's a huge increase. And for really low income people, that is something that might be too hard for them. And then as people are higher up the income level, the percent increase is smaller. But then there's another problem for folks who are at the top of the income distribution, for people who make over 400% of poverty, which is approximately $62,000 for an individual. These people now, when these expanded tax credits expire, they're not going to be eligible for any tax credits at all. So
Mm.
for these people, they're going to see some really profound sticker shock when they go back to the marketplace. And the Congressional Budget Office and many others have estimated that the enrollment could shrink by 30 to 40% as many people decide, given other expenses that they have, et cetera, it's too much for them to afford coverage. And the other thing that we worry about is that the people that leave will be more likely to be the healthier folks, so that the people that remain in the marketplace will be using services more, which might create some bad momentum for premiums in the future. But it varies a lot by state, and I think the last time I looked at the most recent estimates, the projected coverage loss in New Jersey is a little bit below average, and that may be just because it's a higher income state and just sort of
Mhm.
the income characteristics of the people on the marketplace. But it's a really unfortunate setback, but still, for people that really need health insurance coverage, and they're, relying on the marketplace, they absolutely should go out there and look at the plans. No one is exited in New Jersey. You still have the same choices, and see what your choices are.
Yeah, I mean, what I've encountered, this is just anecdotal from friends who have kids. Those who can be on parent plans until 26 or whatever, they're happy and they stay on plans. If they are not on parent plans and if they're young and healthy, they say, I don't need to spend money on health insurance. And you're right, those are the healthier ones. And those were the ones who could get insurance relatively inexpensively, right? Because they're in their early 20s, they're in good shape, they don't have any medical issues. They could probably get, if they all were to buy health insurance, that would, of course, help the entirety of the system because there would be an influx of cash. But unfortunately, many of them say, why should I buy health insurance? I'm in good shape. I don't have to worry. And that therein lies part of the problem. Unfortunately, we just hope this gets
Yes.
settled soon. Yeah. And
Yeah.
we got
No.
about a minute left.
Agreed.
Go ahead. I just want to make sure before we run out, because the commercial hits us hard and we don't have a choice on this end. What is go ahead. Let you finish there. And then please give us a website for more information.
Yeah, I mean, you just raised a really good point that people that don't really feel like they need to use healthcare are the sort of the first to leave when prices go up, and then they're the ones that we can get in when premiums go down, and that's really why the marketplace grew so much over the last few years, is that the plans became more affordable. New Jersey has its own exchange. We don't use healthcare.gov in New Jersey, so the website is called
Mhm.
Get Covered NJ, and that's where you can see what is available to you given your zip code and your income and your age.
The Robert Wood Johnson Foundation has really helped people focusing on healthcare and really helping people all over the spectrum for years. Thank you for being there and helping so many New Jersey folks, especially. We appreciate it. Dr. Katherine Hempstead, such an important topic, Senior Policy Officer with the Robert Wood Johnson Foundation. We appreciate all you do. Thank you for coming on today.
Thanks for having me, Ken.
You bet. Thank you, Doctor. Very, very important. Do not put this stuff off, folks.